Hi, everyone. I'm Laura Mandel. I'm the Public Health Data Lead on the CRISP Insights team, but I'm also formerly on the CRISP Reporting Services team. And I work with the Community Health Resource Commission on their Pathways and Health Equity Resource Community Grants. And so today we're going to be going over the Health Equity Explorer, which is a brand new report that everyone with access to the Public Health Dashboard should have had access to. If you have any trouble, do let our team know. And we'll get started just talking about this. Next slide, please. So just to let everyone know a little bit of background, we'll go through some slides and then I'll switch over to the demo. This is a suite of reports designed to give users an understanding of a given community's health disparities and social determinants of health. The suite currently contains 2 reports. We might build out some later, but these are where we're starting just to see what works, what people need. The Disparity Index and the social determinants of health. And the focus for Health Equity Explorer was really around folks who are really looking at a specific community. So looking at the impact of community health investments, informing community health needs assessments, supporting grant applications, identifying hotspots for interventions, and understanding trends and disparities. The reports use the hospital data from the HSCRC, that's case mix. So if I switch back and forth between saying the HSCRC data, hospital data, and case mix data, it's all the same thing. And the American Community Survey data, that's census data. And so we're going to be showing disparities in hospital utilization and social determinants by race, ethnicity, gender, clinical condition, and geography. Next slide. Okay, so you might be asking, if you're familiar with CRS offerings, you might be asking, how is this any different from what we already have access to in the public health dashboard? The Public Health Dashboard has been a really useful tool for a lot of people to enable health departments and others to see aggregate hospitalization data. These enables per capita measures for total geography. But if you've ever noticed and you've tried to look at disparity-based indicators or look at trends over time by race, it's a little bit challenging because the denominator actually doesn't change. You don't get a population adjusted for whatever demographic you're looking at. So in order to do this, we needed to build a new report that was streamlined. So we could put in all these denominators. We had to take out some extra things that were in Public Health Dashboard to make it run in a reasonable pace. So that is really how we ended up with the Disparity Index tab. And so we'll go through it and kind of show you what we've been able to build, and definitely able to take questions throughout. If you put them in the chat, Grace will be able to share them with me. Next slide. Oh, before I get into the meat of the reports, just to remind folks that you have to have a CRS account to access Health Equity Explorer, and you can access the CRS portal at reports.crisp.org, and you'll have to go through the 2-factor authentication process. If you don't have access to this portal and you do want it, please do reach out to support@crisphealth.org, and they'll direct you to the right person to gain access. And down here below, you can see once you get in, you'll click on the Public Health tab and the Health Equity Explorer, and then the 2 reports will show up underneath. And I also do want to note here that this Health Equity Explorer was funded under the Community Health Resource Commission, CHRC's Pathways to Equity grant to help support Pathways grantees as well as others understand what's happening in their zip codes and how investments in communities is impacting health disparities. So thank you to CHRC for funding this project. Next slide. All right, so I'm actually going to take over now and show you, but just want to remind folks we're using the case mix data, that's the hospital data, and we are going to be able to customize the report with selections to provide information. Okay, so as I just mentioned, you'll come into the CRISP landing page, you'll click on Public Health, and you'll click on Health Equity Explorer, Health and Disparity Index. This is the screen that'll first pull up when you click on that. And so I'm going to walk us through lots of different selections. It kind of seems overwhelming, but it gives us a lot of flexibility on a couple of pieces. So when we sort of come in here and get started, we can see from left to right, we have a number of different selections. This first one here is measure. And measure allows us to pick from a distinct set of measures that were selected based on what was requested under the Pathways Grant, as well as what local health departments have requested. And we did create a limited set of measures just so that the report would move a lot faster. But we could, in the future, potentially add in other ones. We just don't want to sort of overwhelm it with too many. And you can actually look at the help button for the user guide to give you descriptions of what these are. Just to give you a heads up though, hospital encounters typically means it's both inpatient and ED. And if it says ED, it'll just be ED. So that is sort of how you are able to pick those measures. And then the next thing you're able to do is click diagnosis type. But before we get to that, I just want to show you and orient you to this table and graph. So down here we have your state. This is always going to stay as the state, and the one underneath it is you're going to be your selected region that you'll be able to select up here. And right now you can see that these are all the diagnoses for hypertension for Baltimore City across the state. And down here we'll show you the percent difference from the previous year. And then for your selected region, it'll be the same thing. And in your graph over here, you'll have red as the state and blue as the selected region. So I want to go over the diagnosis type now, because this is something new we haven't built into a lot of our other reports before, but there was a really strong request for this. So to do this, I'm going to show you on a specific measure, which is heart disease hospital encounters, and I picked a specific geography. You can select under geography, zip or county, and then under zip code, select a particular county. A particular zip code. And as you can see, the select region is now a much smaller number because it is just for that area. So this is all diagnosis type. And what that means is it's any position in the hospital claim that has a code of the specific diagnosis we're talking about. So it could be in position 1, it could be in position 30. And it could be any point. So they'd be coming in for any reason. We did have a lot of people request that we also showed the primary diagnosis. So this option will allow you to select primary diagnosis or all diagnosis. Primary diagnosis means it was in the first position, which usually means that the coder or the doctor has said this was the primary reason that the person was in the hospital, or it was the reason that cost the most in the hospital. And so that will give people a better idea of maybe these were the ones that were really triggered by the disease in question. And there might be different interventions depending on whether you're looking at the primary diagnosis or any diagnosis. So I wanted to sort of highlight that because that is a change from what we had in the previous reports. And then as we sort of go through, so we've gone through measure, we've gone through diagnosis type, we've gone through geography, geographical measure. The next one on here is time period. And we did have some requests for, depending on what your grants are, you might want different time periods. You might want it on the calendar year or the fiscal year basis. So we have it as an option for you. And then depending on what kind of data you're looking at, for the current year, that's never going to be complete, right? Because the data is a little bit lagged. And so you have two options here. You can either annualize it, which means it basically approximates if you have the same rate you had so far in the year, it approximates over the rest of the months of the year, or year to date. It just shows you the general numbers that are current as of now. So those are your two options there. The one I want to focus on a lot is this measure value. And so measure value is also sort of a new piece for us. And as you see in the first one, sorry, I'm having trouble switching back and forth. We have it on count. So this is just counting the number of visits with these selections. And you can see this isn't really very comparable, right? Because the state has a lot more people in it than this region does. It doesn't really make sense. You can't really do anything with this. But we have the option for rate. And so this rate option, which you'll normally just select by clicking the radio buttons, this rate option will actually control and show it over the whole population. And you can see here that the state is still higher than this particular zip code, but it's a lot more reasonable. We can kind of understand the trends a little bit better because it's adjusted by the population. And then the next piece that I was really excited about is this age-adjusted rate. So what we're doing in the age-adjusted rate is saying if the area of interest, so this zip code in particular, had the same rate, had the same population distribution, like the same kind of probabilities of older people and younger people as the state, what would their numbers look like? And the reason we did this is because in epidemiology, a lot of folks know that if you have one population that is a lot older than another population, by virtue of their age, they're typically going to have a lot more health concerns. And so it kind of complicates things if you're trying to compare two populations, one of which is much older and one of which is much younger. So our age-adjusted rate gets rid of that and lets you to compare sort of the two together and give them more equal balance because you're not worried that there's different distributions based on age. So that is our top half. The one thing I want to note on this top half here is that if you do select some options where, oh no, it's going to reload, where you have selected a zip code that has really small numbers, and this happens, going to happen a lot on the primary diagnosis, it's actually just going to say null or NA. We're not allowed to show if there's fewer than 11 people with that condition in that cell. So that's just a note. If that happens to you, try to combine zip codes, which is possible. You can select more than one, or go to a bigger group. Okay, so you might say that's all great and fine, but you talked about this being useful for health disparities. I'm not seeing it. So the bottom half of the report shows you the abilities to select by disparity. So what's important to note here is that everything you select up on top directly impacts what happens below. So for this one, it's going to be heart disease hospital encounters, all diagnosis in the zip code with this time period using the age-adjusted rate. And so for this, we're going to see that I'm actually going to put us over first to the regular rate. 1 second. Not letting me do that. Okay, so I can just show you here. By the age-adjusted rate, we can see that the white population, the Black population, and the other population are relatively similar. The other population we're seeing is lower, but we're seeing this huge spike in the Asian population. What's something that's really interesting is that if you look at just the rate, so without the age adjusting for this zip code, it'll just take a minute to load. Oops. Now it's definitely gonna take a minute to load. Okay, I have it pulled up here. So even though we did pull out things to make it go a little bit faster, it does sometimes have a little bit of a lag on it, probably because I do have so many tabs open at the time. I have some other stuff happening as well. Well, what you'll see when this eventually loads by race by rate is you don't see that line on the Asian population. And that might be because the Asian population has a much younger population, but they still have huge rates, large rates of this particular measure than you would expect, or maybe just because the numbers are pretty small, and so it's hard to make assumptions about it. But this is something that, so as you can see here, this is not that giant line we saw before, right? This is very steady. And so that's something that if I was a health officer or if I was someone in this zip code trying to apply for a grant, I might be like, that might be the population I want to talk to. This information is not going to be enough to be like, this is definitely where we need to do an intervention. But maybe I'll be like, I need to reach out to folks who are connected with the Asian community in my zip code. Let's see what's going on. Are there additional resources that they need? Is there something here that we need to dig into? And so that's really what we wanted to be able to provide to folks, is this option to think about the data looking differently. And so that's just something I would recommend that folks play around with, see what happens, but also know that if your numbers are really small, there's like not that many people of a specific race in your zip code, it is going to make the numbers a little bit unsteady. The other thing I wanted to point out is this disparity index. So we've talked already about what these rates are going to be. So this is just those same rates as above, just for the specific geography and split out by race. This disparity index compares everyone, all of the other variables, the values in a specific category to a reference group. The reference groups we're using are going to be white, male, and non-Hispanic. Just what they typically do in literature and things as well. And so you can kind of see a direct comparison with the sort of reference group. As in this case, we can see that this one is a lot higher for the white population. We saw when we age adjusted it, there was a big difference there, and that will tell us a different story. So that kind of gives us a sense of if you want to look at for specific diseases, for specific diagnosis types, for your geography and comparing things. You're able to, I should also note that you're able to pause. So if you want to make a lot of selections at once, you can pause so it doesn't have to reload every time you change something. You can also press help to get the user guide, print the PDF, or export the Excel. So I'm going to pause here and see if there's any questions on the Disparity Index tab before I move over to the SDOH tab. Not seeing any yet, so I'm going to move us right over to the SDOH tab.
Oh, Laura, there's a question that came in.
Okay.
So the question was, can you choose 2 zip codes to compare?
In the current functionality, you cannot. You can combine 2, or I would recommend you look at one, pull the numbers or export the numbers out, and then click another one and export the numbers out. You are able to combine them, which is a unique feature. So let's say I wanted to, so this is something that's been really important for the Pathways grantees and for the HERC grantees, as I mentioned, under the Community Health Resource Commission's grants. They need to have at least 5,000 people to be eligible to submit. And so they need to be able to combine geographies. So with this tool, you can combine those geographies, which is really exciting, but you do have to do them separately if you want to compare to, right now at least.
And we have a couple more questions coming in too.
Great. So
go ahead.
The disparity index really just compares, it does a direct comparison for you of the different categories compared to the reference group. So in this case, the reference group is white, and you'll be able to easily tell what the reference group is for any of the different pieces, because we'll just say 1. So it makes it really easy to compare that the black rate was 0.71 of the white rate. And then you can see that that has changed for the different populations. And when we adjust it to, I'm afraid that it's going to take me a minute to reload it. Let's see if I can get the age adjusted rates up. This is the same data. You can see now with this change that the Asian population is 3 times higher than the white population. You can see that change that we did just switching from the rate to the age adjusted. So it just uses a reference group, so it makes it easier to compare. Instead of looking at 35 to 11, you're looking at 3 to 1. So have we considered using a race ethnicity composite? Yes, we absolutely would love to do that. We are a little bit restricted because of the way that the census data is. This report is very focused on the community data and the community population, which we are able to pull from the American Community Census. In order to get to a zip code level, they actually do not provide race and ethnicity together. We have previously talked about showing an option for white non-Hispanic versus everyone else as an option. That is sort of our only workaround at this point. But that's really because we're limited by the data that we get from the American Community Survey. In other reports that CRISP has, we do that combined ethnicity and race because we can get the county data or the state data from the Maryland Department of Planning with the composite variable. So definitely understand if you're interested in, non-Hispanic, it just gets a little bit challenging. If you're interested in specific groups, let us know. We'll try to accommodate and figure out how to do it. But so far we have been limited by what's in the census. Is there any way to look at race by age? So right now we are not allowing a crosstab, but that's something we could build in the future. The reason we didn't do it is we really wanted to offer this age adjustment function that we hadn't been able to do before. So that would require a little bit of a different section, but if that's something that folks are interested in, we can definitely have it on our future list. So gender, you're asking all of these questions that really, they keep me up at night, to be honest, and I think about them a lot. So the gender sex question is very challenging. So for the numerator, for the hospital data, what we're doing is we're taking it from the HFCRC's data, and that is administrative sex. So that is defined based on however the hospital is defining it. It's a little bit complicated. It's something I want to sort of move on and continue thinking about and talking about. But right now is administrative sex for the numerator. And the denominator, I believe they just ask folks in the census, but I'd have to honestly double check. I don't remember that off the top of my head. Any other questions? Okay. I'm going to run us to the SDOH report, which is both exciting in some ways, and people also get a little bit disappointed because it doesn't have data that we're getting in from our system. That's something that we're still working on, trying to get as much assessment, Z code, and other data into our system so that we can show it and compare it with other data. Right now, this SDOH report is based on that American Community Survey data, but we know that's publicly available, but it is quite challenging to use. And we know it is hard to kind of identify that data that you want for the zip codes you care about, the geographies you care about. So we've made it a little bit easier for you if the report would load. Right, while that's loading, I can just show you what it's going to look like. So we are providing an interactive map. It allows you to select by geography for county or zip code, and then select by year. And then we've created a couple of measures for you. These are based off of sort of some recommendations from what was in CDC's Social Vulnerability Index, as well as what was really helpful for the Pathways grantees in the previous grant cycle. And so we have calculated these measures for education, which is percent not graduated high school, percent unemployed, percent below poverty, percent no vehicle, percent occupants per room that is above 1. We should put that note in there. And then language speaks English less than very well, and income is per capita. I think it should have, no, it's still thinking. So what you'll be able to see in this report is you'll be able to toggle for the measure for the year, and then it'll color code it based off of a standardized color scheme. And down below here, you'll see the measure definitions that we have. I can also provide even more information about the variables, although I do believe that they're in the user guide as well. And you'll be able to see these colors change as well for the zip codes. I'm just going to reload this. I think it's a little stuck on a wheel. Nope, it's decided to log me out. Sorry, everyone. I'm not going to be able to show that to you when you switch over to zip code. The one thing I'll note here is you're able to export this as well into Excel. At the current point, we have, for the zip codes, we have adjusted it to make the colors work, which has adjusted the data that's in the export. So right now, if you export this SDOH data for your zip code, it might be a little bit off. We will be correcting that in the next week's update. So I would sort of hold off on exporting any zip code data from here just yet. But next week, you'll be able to do that and pull that all down. But you'll still be able to use this tool right now to look at the colors, kind of understand what's happening. All right, so questions. Are there any plans to provide this data at the census tract level? We could provide the SDOH data potentially at the census tract level. We typically can't provide the health data at the census tract level, and we wanted to kind of be consistent between the two. But if folks think it would be helpful, and I'll explain why, because of the cell suppression, because we really need to make sure that we are not releasing PHI, we typically don't show things at the census tract level. But if there's interest in showing SDOH data at the census tract level, even if we can't show at the health data at the health level, we're happy to do that as well. So folks, feel free to let us know if that's of interest. Yes, so they are, if you're familiar with the ACS, and again, this data is all in the user guide. We are using the 5-year ACS estimates. So that is going to be 2017 to 2021. The 2020 number here is going to be 2016 to 2020, then 2015 to 2019, and so on. Okay, so I think that this tool is really going to be helpful for folks that don't have accessibility to data as easily and want to be able to look at things. We kind of see this as a first pass at providing data. We know there's a lot of other things people have requested. Even just today on the webinar, we've heard a lot of different things that people are interested in and might want to see. But we're happy to sort of take more questions. We're happy to take more suggestions. And whatever people are interested in, we want to try to understand and sort of be able to show that. I'm going to let folks keep thinking, keep playing around if they're in the tool. The download links do not have a GeoID column. Are you thinking, Ricardo, for the FIPS codes?
Yes, I was just saying if we download the files.
So they don't, but that's a good idea.
Okay.
Wish I could. All right. If you guys want to wait a second while I get back on, I can show you what I might do as I'm logging on. One of the cool things that I have been able to find with this tool. You can see the whole process of me logging in now. I tried to save you all from it, but I could not. Okay, let me pull up the SDOH report because that's where we stopped last time. Great, so we can see it's showing up here. When you go to zip codes, you can see that the whole map will readjust for colors, and you can really see where the education pieces are. And as I mentioned, we did adjust this. So you might have some values that are really, really high, just so that we could make sure that the map made sense. We did sort of cap them at percentages, at top percentiles, so that we could actually see something useful from the map. Before it kind of used to be all blue and little specks of bright red. So now we kind of have a little bit more that we can see. And so we're able to see some different pieces here. You'll be able to see, sort of not surprisingly, there is a big Hispanic population that speaks Spanish here, but maybe some other groups here that folks aren't aware of or didn't know that there are some big groups where the English speaking may not be as high, and so there might be additional resources that are needed to reach out to those communities. Similarly for transportation, You know, unsurprisingly, that there is lower car usage per household in Baltimore City. We're not surprised by that, but you might be surprised by some other places where there's low vehicles, and whether or not you know that there's good public transportation there or not might have sort of indication that people might have trouble getting to their doctor's appointments or to their preventative visits. So that might be something that you would want to then go after as an intervention. So those are some of the ways I might try to think about this as I kind of I'm looking at my county, I'm looking at the area that I serve, where there's some areas that maybe I'm not so familiar with that might sort of lead us to ask more questions. None of this data is going to sort of be your be all end all answer, but it kind of helps you indicate where there might be an issue where you might want to ask those more questions, talk to folks who are working in that place to really make sure you understand what's going on, and then be able to potentially share this information in a grant application or things like that. So that's kind of some of the ways I would use it. Potentially, you could also like look at by year if things are changing. I honestly haven't looked at that in depth, but if someone is interested and wants to look at that and see something interesting, that might be good. I don't think it's going to change that much year over year, to be honest. I mean, we're seeing a little bit of change, but not a huge amount. I mean, we might see some change in employment, honestly, across the pandemic. You can see things change a little bit. So yeah, so that is sort of, we wanted to be able to offer this to folks. If there's any other questions, any other measures you're interested in, one big one that I know is the one that people usually bring up is food, where there is food scarcity. There's not a good measure of food scarcity or hunger in the ACS. The best thing we have is food stamp percentages. That's something we could add, unfortunately. And so I'm still looking for good data sources to use that we can use at the census tract level, at the zip code level, I'm sorry, for food, other than just percentage on food stamps. If folks have ideas or know about them, we're so happy to hear about ideas. And just for folks, this is the SDOH report. It's underneath the health equity report. It's just a second tab. Right, so I'm gonna stay on for a bit to see if people have other questions, have recommendations. There is if you press the help button, there's gonna be a PDF for the user guide, which is gonna have all of the information. It's gonna tell you what census variables we're even using for this. It's gonna tell you exactly what the definitions are in the disparity index, how we pulled them, which CCW codes we're using, and things like that. And so if people have questions about any of those things, or want to know why we did something one way versus another way, feel free to reach out. We're happy to answer those questions, and always happy to make these reports better. Again, we just released this one. We had a group of beta testers, but we haven't really had people trying to use it in bulk. So definitely, if you find a bug or something you don't think is right, let us know as well, because we're only going to be able to make the tool as useful as we know that there are problems. If you're having trouble accessing the report, first I would make sure that you have a CRS account, which is the CRISP reporting account. So if you've never seen this page before, you probably don't have one, and you need to reach out to support at CRISP Health. Can the team actually put the exact email that they should be putting in the chat if you don't have access to CRS already? If you do already have access to CRS, you can access it through the Public Health tab, and then on Health Equity Explorer. I think the team, if you want to contact support at crisphealth.org, if you don't already have access, you can definitely do that and just request reporting Maryland. Yes, thank you, Grace. And sorry if folks don't know what I'm responding to. I'm getting both messages that are public and direct messages, so I'm just sharing the answers with everyone, so folks who might have similar questions also get those answered. All right, I'm happy to stay on for a few more minutes this is kind of like it's kind of like a passion project for me. I really want to be able to show where we have disparities. I really want to be able to show folks who are doing the work on, improving health and getting people what they need, whether it's, health things or it's going to be things in their communities. I'm really want to make this data available for us. So any other suggestions you have or ideas, a lot of my answers are probably going to be, we tried, we couldn't do it. But hearing that people are interested in things is really helpful. Okay, great. Yeah, like I said, I'll stay on for a minute or two, but if folks want to drop off, you're welcome to. If folks want to continue playing around and ask me questions. Okay, does the map always show the entire state or can we limit to just one county? Right now we've only shows the entire state. You can zoom in to show your county or you can click. We don't currently have a function to select counties. Partially that's because there are zip codes that fall in multiple counties. So it's hard to select a county. We'd have to make decisions about if a zip code fell in more than one county, does it count in both? Does it overlap? So that's why we don't have one. If that's of interest, we can talk about doing it, but it would be a little bit complicated. Righty. Let's stop our share. So feel free to reach out to us at I'm seeing one more question. Would legislators be able to get a CRS account? That is a really good question. Let me take that back. Let me take that back to our legal team and let you know. All right, great. Feel free to send us questions that you have either to me directly or to the support at CRISP email, and we are happy to take questions. We're happy to talk about other things that you need or would be helpful. Yeah, and thank you so much for joining today. Bye, everyone. Have a great day.